Joining us as part of the RUHS Innovations webinar. Uh, we are excited to be starting our webinar season again, and it's been fun. I hope you were able to join some of our webinars over the last 6 months. We're back after a few months hiatus, and so today we are going to be talking about mental health as the pandemic has kind of dragged on. I think it's become more of a grind for people. And so we thought we would open things up with Dr. Matt Chang and Dr. Jeff Leung. Dr. Chang will be talking about what mental health has been doing to what behavioral health has been doing to address mental health throughout this pandemic, what options are available to people, and how we can develop connection. And then Dr. Leung will be speaking to how we can safely interact with other people. We've obviously had a lot of guidance in how to do that in the workplace, and there has been guidance of how to do that with society, but that can be a challenge implementing it when you're, say, meeting with a family out of necessity. So for instance, if you're having to have grandparents to come over to take care of kids and that kind of thing. So he'll be speaking to that. But we'll start with Dr. Matt Chang kind of speaking to us about what behavioral health has been doing to address mental health across society or across our county.
Yeah, and thanks, Dr. Versio, and appreciate you having me here, and good to virtually see and hear from everybody again. I think something Dr. Versio said is very true. Is the concern that as this has dragged on, what does it mean for our community and society? And I think there's been the idea that since this has started, that the pandemic will lead to a mental health epidemic, and what we see obviously throughout all the different facets of society are increased stressors. And we're very concerned about our youth, and I think that'll be a topic of conversation coming on today. But, in addition to the concerns about getting sick or not getting sick and all that goes in along with that, there are economic concerns, there are family concerns, they're concerned about elderly loved ones, maintaining a job and being able to continue to function in society during a time where it's the news changes every day. There's an onslaught of news, and trying to find the signal throughout the noise is a challenge. So on the behavioral health side, I think what we've done is we've taken it very seriously and always kept our clinics open during this time period. So we have transitioned, I think, as many folks have. We have previously had a core team, so it's just kind of a skeleton crew working our behavioral health clinics before during the first surge or the first height of this pandemic. And then as time has gone on, and we started to see negative impacts in the community relating to behavioral health, we have brought our staff back to work in our clinics. And so we have all our sites open currently. We also currently still have all our crisis continuum. So these are our mobile crisis teams, our mental health urgent cares, our crisis living centers, as well as our psych ER and psych hospital service. So we are still providing services primarily virtually, with our staff being able to provide remote services to wherever the patient may be. But we have the capacity, if a patient needs to come in or wants to come in, to see them in-house or in person in the clinic with the appropriate PPE provided to our staff. So I'll pause there, Dr. Versio. I don't know if that's helpful or useful, or what else you'd like me to comment on, perhaps.
Yeah, that's very helpful. One of the things that I think people have been concerned about is the support for groups and things like that. A lot of mental health is done in groups, and so how has your service kind of adapted to the limitations, and how has that been over, when it's offered virtually?
Sure. So I mean, transparently, it's been a real challenge. I think what we know for our consumers, and generally we deal with folks who are the most vulnerable in the population. And I'm going to go off on a tangent, but I'll come back to it. I think part of what we've noticed is during the pandemic, our clinics serve not just the clinical function in terms of seeing your psychiatrist, seeing your therapist, getting help with social services, but also a real social function. We have a lot of patients who come into the clinic sort of to hang out, to chit chat with the front staff. We have movies oftentimes in the lobby, and the other patients are kind of their friends and their support structure. And so what we saw, although we were able to provide, during the whole pandemic, this individual service, what we noticed is kind of that breakdown of community as it pertains to behavioral health as a system. And that's still a struggle because we obviously don't want our waiting room packed with a ton of folks and increasing the risk. But we have provided groups virtually, so on a Zoom or a Teams or pick your platform process. And we're sort of getting better at that with time, I think. It's still a challenge. And so from both the mental health side of it and the substance abuse side, we are providing some services virtually. We're talking about what that might look like in person groups. But again, being mindful, as I think everyone is, with the risk of spreading of COVID-19. I'll pause there. I don't know if that answers your question, Dr. Versio, about some of the efforts we've taken.
Yeah, that definitely does. What do you feel like have been some of the very helpful innovations that your team has had to implement? And have there been things that actually you tried and they didn't work so well, and it'd be helpful for other people to know about those things so they don't try to replicate something or try to do something that isn't useful?
Sure. So learn from my mistakes. I think when this started, there is a big push, as I think many other organizations went through, to telecommute, to telework, and provide the services virtually. And so and big shout out to our IT team who got our laptops ready, all the virtual things necessary. So we provided a lot of services virtually in the beginning, and a lot of phone services. And I'll pause here, and I'll think that for a lot of patients that might work well. I think we know that in some cases, for some patients, their virtual visits work very, very well. Again, I think what we notice with and so we start doing this, we see our no-show rate go down, we see the visits drop, but then kind of come back to almost baseline. And from my perspective, like, hey, this is going not so poorly. We have over 60 clinical sites. Is there a way over time where this is the future, and maybe we'll need fewer physical plans to be able to consolidate more of our sites? But I think what we've seen is, even during a time where we've ramped up telehealth visits, obviously, phone visits, obviously, it seemed to be going okay for a while. And then somewhere along the way, I think our patients started to struggle more. And I don't know if anyone knows exactly, was there a demarcation or what was cause, but I think it goes back to something you said. I think as this is dragged on, people's sort of internal reserves have been depleted. And so then we started to see an uptick in adverse events. So we've seen some suicides. We have seen overdoses, whether they were intentional or not. We have seen an increase in need for crisis services, and people going to require those types of services. So remember, this is in the context again where on one hand we see those visits go up, we see no-shows go down, like, oh, it's going pretty well, but at least for our specific patient population, that may not be the most effective for those folks. And interestingly, I'm part of the California Behavioral Health Directors Association, which is just our little group of colleagues that chat. And we talked about this because I think other counties were seeing similar data in that their no-shows were going down, their telehealth visits were going up. But despite that, we've started to collectively seeing some of these negative outcomes in the community. And I think that really spurred us to even provide more services in person, and to provide kind of that structure, as I mentioned earlier, with our clinical operations. So, a bit of a rambling answer as per usual, but I think we move quickly to virtual given the concerns. For a while, things seem like they're going well. Over time, we've noticed more concerns, and so we've had to try to address that going forward.
Yeah. Now you mentioned that you deal with a vulnerable population, and are tasked with trying to figure out how to address their needs, which I imagine is a challenge with a conversion to telephone or video encounters, that they may not have those modalities to be able to get their mental health, or as you had mentioned, that probably isn't enough, and so you kind of address that with in person. But yeah, how has that been? Have there been any programs to assist these vulnerable patients with connecting with their psychiatrist or mental health?
Yeah, so we've got several arms of that, I suppose. We have our FSPs, our full service partnership programs. Those are our intensive outpatient services, which we provide, oftentimes mobile. We have helped not only those patients, but other patients as well with the actual technology piece of it, in terms of devices, be able to use that so they'll be able to remote in. Um, the other large part we've tried to do during this is take a look, as I'm sure everyone has, at congregate living situations, because
Mm.
that's certainly a concern, and the higher risk of COVID there, kind of married with the homeless population, as well as those folks experiencing homelessness who have mental health issues. And so I think kind of in conjunction with the county's Project Room Key and now Project Home Key, we try to be very aggressive about building out housing options and placement options during the pandemic, because um, to no one's surprise, I think what, as this has ramped up, placements have become more challenging. We often work with state hospitals, with Institute for Mental Diseases, or IMD beds, that's just what they're called. Other these different placements that there's been kind of more of a gridlock we've seen during COVID. And so some of our work has been building up that internal infrastructure to be able to maintain throughput. So we built up a MHRC, or mental health rehab center, on the grounds of the Riverside Juvenile Hall, which is 38 beds. We have, fortunately, it was always in the plan, but we've expedited the time frame. We opened Roy's Treatment Center out in the desert. That's a 92-bed augmented boarding care facility, and we're in talks with different agencies and entities to kind of bring on more options, because for example, just in the city of Riverside, I think there are 500 unsheltered folks per the city staff, but also for behavioral health, there are 370 odd people living in congregate situations there. And so by trying to build out more of our housing and placement options, I think that allows us to decongest some of those facilities. I know also there's a lot of concern from the hospital side regarding 5150s as a way to further build out the continuum, use the continuum maximally, and decongest as much as we're able to. So I think those are some of the learnings that we've experienced during this process.
Yeah. Now, for those living in congregate living facilities, are you providing kind of mental health support as part of that environment where they are already naturally gathered, and you could kind of provide a community of support there through, that infrastructure might already be in place?
Sure. So I think yes, the short answer is yes. I think the type of service depends on the level of care. So in my mind, you've got the inpatient psych level of care, you've got kind of the IMD level of care, and kind of between those we have the MHRC level of care. Then you've got the augmented boarding care facility, where we have a full service partnership team there to care for those folks, and as well as some of our sober living or recovery residences, as they're now called. On the substance abuse side, we do provide services in those congregate living situations as well, either internally or via a contractor. But the amount and type of services is dependent on what those patients' needs are, essentially.
Okay. So I want to give space here for anybody that might have questions that I can ask Dr. Chang. So if you want to put those into the meeting into the meeting chat, happy to kind of address those questions. I'll ask a more personal question while we're waiting for any of those that might come in. And this is kind of from the framework of, I've had several kind of mantras that have been very helpful for me going throughout this pandemic. One of which is lessons learned. And I got that from Dr. Larry Liu, who, early on we were kind of trying to put together a Zoom workshop, and neither of us had done much on Zoom. And so, he shared with me that lesson. So I've kind of, or that mantra. So I've kind of carried that with me throughout. Another one is that I've been thinking a lot about is community resilience, and that the resilience of a community or even of an individual person isn't necessarily influenced by that individual person, but by the bonds between people. And so obviously doing whatever I can to bonds between people, throughout this pandemic. So in the workplace, that's one of the places where we do get to socialize. And so anyways, I was curious what your mantras might be that have kind of kept you sane throughout this.
I have to have a mantra, huh? Well, I think, if I were to kind of piggyback off yours in terms of lessons learned, I think it would just be extending grace. I think this is something which has obviously been an incredible challenge for all of us, and has affected us in different ways. Unless you're 100+ years old, this is your first pandemic, and hopefully collectively it's our last. But I just think everyone's been stretched and pulled and had to innovate in a challenging environment. And so, for example, we're having to put things together from a capital side much quicker than we would ever have dreamed, building these new programs on the fly, figuring out technology. Just as in a side note, I couldn't figure out how to get on this thing until about 30 seconds before. So thank you, Dr. Versio, and extending me grace. But I think everyone's going through something, and I think that applies in normal everyday life, but it's especially pertinent during the pandemic. So for those people who are trying to, and I know we'll talk about schools later, but trying to homeschool their kids, I've also learned I am absolutely horrendous at that. And just extend grace to folks. Everyone's having a difficult time. Everyone's trying to do the best they can, and pivot and respond to just the changing environment at all times.
Yeah, absolutely. I think that's been something that I've seen. Lots of people extending grace to each other. This, as you said, has been incredibly challenging, and I've been really impressed with how at RUHS every level has from the people at that do our cleaning all the way up to the C-suite have handled this. I mean, I think everybody's done it by extending grace to each other, really coming together as a community to figure out how do we address this and deal with this. And it's been really impressive to be a part of the way we've responded. So anything that you have, what are you looking forward towards with behavioral health?
I think a whole separate conversation, but I think we're excited about continuing to build out our intensive, full service partnership programs, kind of hand in hand with that. Very excited about the ongoing partnership with the CHCs on behavioral health integration. I think that's certainly a huge benefit for the community. We're excited about that. And it's weird to get excited about buildings, but I think in terms of some of the infrastructure that we're in the process of building out, that will have long-term positive ramifications for providing services in the county of Riverside. So I think all those pieces kind of coming to fruition. I'm just going to work with all of you and Dr. Leung and all the stuff we're doing on the integration side of the house. And again, what that partnership has allowed us to do is to sort of focus on our core competency on the behavioral health space for those people who need intensive, aggressive services. Just excited about seeing that develop.
Yeah, good. So last question is, if anybody on this call, were to need some behavioral health support or knows somebody that needs some, how do they get a hold of your service, or what call line do they use, that kind of thing?
So I'm going to cheat here for a second. So the numbers I can put in the chat after this, but it's 800-499-3008. And so that's 24/7 staffed by our folks that can give some help, give some advice, get plugged into our service throughout the county. There's also an employee support number, which I'll also put in the chat. That's 951-955-7015. This was initially for RUHS folks and then kind of health folks, and then we've extended to basically anyone who wants to call in and ask for some coaching, some assistance. It can also provide referrals. And then lastly, during the pandemic, we also rolled out our Take My Hand app. This is pretty cool. It's takemyhand.co, and I'll put in the box again. But this is a app. It's a texting app, and so for people who may not want to call, or kids these days, all they want to do is text. It's a way to get to communicate with a live human on the other side and get help with services, and also get referred into whatever they need. And then I think the last one is a serious one, is the 951-686-HELP. And that is the Riverside County, the local suicide prevention crisis line. Because again, just during this time period of increased stressors from all sides, we want to make sure that everyone has access to what they need.
Yeah, thank you. All right, we're going to transition at this point to a conversation with Dr. Jeff Leung. One of the things that I think a lot of families have faced is the situation of being forced to, quotes, gather. The state obviously has guidelines currently to not gather unnecessarily, but many families have to do that out of necessity because they need their grandparents to take their kids while they're working, or that kind of thing. And so, Dr. Leung and myself had a conversation that with public health on how to safely, if you have to get together with somebody, how to do that safely, and the layers of protection that would be involved with that. So I'm just wondering, Dr. Leung, if you can kind of walk us through, what are those layers of protection? Obviously, we're using a lot of them in the workplace, but what kinds of things, if people do have to gather at their home, for those reasons, how do they do that as safe as possible?
Thank you, Dr. Versio. So, perhaps we can talk about, interactions and how we can make interactions as safe as possible. So we know that can happen, in a work setting, it can happen at a home setting, it can happen when, you might be going to the grocery store. And I think the gist, the general premise is there's sort of no one magic bullet. But if you think about sort of applying different types of protection or different layers, added together, they can really decrease the risk for transmission of COVID or picking up other types of infections as well. So hopefully, some of these, sound very familiar, but the things that we've talked about over the past several months, they still work really well. Whether it's distancing and just trying to make sure that, whenever possible, you're at least 6 feet apart from other individuals, wearing a face covering or a mask. And we do think, that's been adopted much more in our society now, and we see, the benefit and the good results in the declining cases because of that. It's good hand washing measures and making sure that, if appropriate, if people are at work, they're wearing gloves. But for most people, it's just regular hand washing. And if you have kids, it's helping them develop these habits as well, so that as they go back to school, as things reopen, they have those habits that will keep them healthy, even when mom and dad aren't around. But I think in addition to those, what we're trying to talk about more and more, especially as the flu season is coming, definitely getting vaccinated for influenza, we think of as a protective layer. And that's because, as cough, cold, and influenza season approaches, it will be very difficult to distinguish between those types of symptoms and COVID symptoms. And having that vaccination, that we do know is safe and effective for flu, can keep us healthier overall and sort of decrease some of that uncertainty. And then on top of that, we've heard a lot in the news about sort of scenarios in which it's much easier to have spread. And those are the types of things we want to avoid. And sometimes, we let our guard down. So it may not be intentional, but definitely, if we're in the break room or if we're having a meal together, and now that in-restaurant dining is sort of opening up in more places, in addition to outdoor dining, we know that kind of prolonged periods together, eating and drinking, and kind of having that conversation without appropriate masking or distancing, that definitely increases risk. We also know that if you do have to have interactions with individuals or prolonged interactions, definitely outdoors is much safer than indoors. Definitely upwards of 100-fold more, safer in an outdoor setting than an indoor setting where your circulation, may be limited, where you may not have great ventilation. And that's actually sort of the scenario where we've seen some of these cases, whether it's a choir practicing in a church for 2 hours, or if it's a school setting or a fitness center where people are all kind of in the same workout class. And I think that happened more towards the beginning of the pandemic when we didn't have as much knowledge. And then just a final couple pieces. I think some of these are common sense, but it's always helpful to remember that, the more people we interact with from different groups, the higher our risk. So being able to limit our interactions with fewer people or kind of stable groups is definitely, safer, less likely to cause transmission of infection. And then finally, sort of the time that we spend with each other as well. So, the longer we're together, the more likely we are to have for spread. When we look at contact tracing, we're actually looking for an official time window of 15 minutes or more in close contact. And then we consider that significant enough spread or significant enough contact that we would then sort of go into the process of case investigation and contact tracing.
Yeah, thank you for sharing those, Dr. Leung. I think, as a family, it's often people feel reassured. Oh, well, it's just a few of us that are here. So when they're in the house, the grandparents might come over to watch the kid. There's, they may not be as cognizant of the masking. And then one of the other things that we've talked about is vigorous activity or laughing or singing or those kinds of things, as increasing the amount of droplets that go into the air that can then, infect somebody else. And so the value of, if you are going to be doing any of those things, making sure that that's outside. And especially if, the grandparents stayed for dinner or something like that, often we're laughing, telling stories and all that kind of stuff during dinner. And if that could be outside and then spaced a little bit farther apart, that would probably also help as well during those kinds of situations. So
and just to add, I think sometimes we do feel social pressure. For instance, if a close family member wants to come over, but they're from a different household, how do we behave in that setting? Will it be rude if I'm going to suggest something else or not to, get together? But definitely for those caregiving situations or where you do have people that need to enter your home, we would recommend that people cover their face, that they mask, that they sort of keep their distance, that, we're lucky in Southern California. It's often, very practical to keep windows open. So just because you've allowed someone into the home doesn't mean that all guards and measures are off. And those continue to protect our vulnerable populations, especially.
Right. And if the grandparents are watching the kids, good to let them go outside and play outside and do that kind of stuff. That would decrease the risk of, if the child was asymptomatic, from them spreading that to their grandparent or aunt and uncle. So, okay, thank you so much for spending some time with us today. I hope this has been helpful. I don't know if anybody has any questions for Dr. Leung really quickly. You can put that into the chat box. He alluded to flu as kind of one of the other big issues that's going to be coming up. We're going to be covering flu in our next webinar and kind of the RUHS plan for flu, which we're intensely discussing currently with the physicians and other leaders across the organization, is how can we approach flu most effectively, flu season and the flu shot. And so that's what we'll be focusing on for the next webinar. It looks like no questions have come in so far, so thank you so much for spending time with us today. Hope this has been helpful for you, and we'll close out today's webinar.